Today we are going to discuss the most common rheumatological problem, that is rheumatoid arthritis. Hi friends, I am Dr. Rajkiran, Managing Director, HRC Hospitals, Hyderabad. Rheumatoid arthritis is a chronic inflammatory arthritis. It's going to affect multiple joints, especially the finger joints, knees, ankles, shoulders, and hips. So this disease commonly affects women, especially women who are quite active in their house, like women between 30 to 40 years to 60 years. These are the age group where this disease commonly affects. Among the sufferers of rheumatoid arthritis, we see almost 7 to 8 are women among 10 people. If you see the patient suffering with rheumatoid arthritis, nearly 7 to 8, almost like we can tell like 7 to 80% of the patients suffering with rheumatoid arthritis are mostly women. This is a very important disease to be known. Why? Because what makes this rheumatoid arthritis very special and the most important thing to be understood is this disease doesn't restrict itself to joints. Once this disease affects, there are chances that this disease may also cause other complications which can involve lungs, eyes, and in late stages it can also cause cardiac problems. So it's very important to know how to manage rheumatoid arthritis and what are the symptoms of rheumatoid arthritis and how to pick up these cases early. So I am going to tell you what are the symptoms of rheumatoid arthritis, how it has to be identified, and what are the investigations which doctors do confirm the rheumatoid arthritis, and what are the modern treatments available to treat rheumatoid arthritis. First thing, who are affected with rheumatoid arthritis? As I said, most commonly this affects women. Women in the fourth decade, that's in the 40 years around menopause time, are commonly affected. Sometimes this disease can also affect younger women. Women of around 15 years, 20 years group also can get affected. Children also can get affected with rheumatoid arthritis. That condition is called juvenile rheumatoid arthritis. It's not very common in elderly, but still elderly people also can get rheumatoid arthritis. That we call it as in late onset rheumatoid arthritis. If rheumatoid arthritis occurs at the age above 65. Men also can get affected with rheumatoid arthritis. So how this occurs? So scientists have looked into the causes of rheumatoid arthritis. So genetics, if somebody has genes which can develop rheumatoid arthritis in future, if they are having that genes which they have acquired in the family, so there are chances that they can have a tendency to develop rheumatoid arthritis. It's not like that if the parents have rheumatoid arthritis, it's not like that children also will get rheumatoid arthritis. But there are little bit higher chances of having rheumatoid arthritis. We need to take certain precautions and we need to take care. That I'll tell you later on what to be done. So the patients with a genetic background to develop a disease, if they get any viral fever or if they go through a lot of stress or some injury or trauma, these are all called environmental factors. If they have suitable environmental factors, they can develop this disease. So lots of genes have been implicated in development of rheumatoid arthritis. So but there is no particular specific gene which we can tell that this is responsible. So multiple genes have been identified, and at the same time, again I'll tell you, it's not like that if you carry the genes you will develop rheumatoid arthritis. Lots of these things, environmental factors, stress, pollution, infections, so lots of things. Sometimes post pregnancy women can develop arthritis immediately after pregnancy. So lots of these things can get involved in development of rheumatoid arthritis. Symptoms. So patients start with symptoms especially in the finger joints. So the hands can become stiff, especially when you get up in the morning. When you wake up, patients might feel the stiffness and pain in the small joints of hands, and this stiffness and pain may last for 1 hour to 1.5 hour to 2 hours. Then subsequently they start feeling better in the afternoon, and again in the evening and night they again might start developing these symptoms. So it starts like this. Over a period of time, if not properly treated, these symptoms may get worsened. The one which started from the finger joints may spread to elbows, shoulders, knees, ankle and feet, and it might make them crippled if not treated properly. They might feel it very difficult to get up and walk from the bed, and throughout the day they might have the symptoms. So these symptoms should be identified at an early stage. If you develop pains in your fingers especially, and if your fingers are becoming stiff in the morning, and if these symptoms are lasting for more than a month, and if these symptoms are improving as the day progresses, but again you are getting in the next morning, and from the middle of the night if you start getting pains. So these are the things where one should suspect whether we are you are suffering with rheumatoid arthritis or not. So once if you reach to the doctor with these kind of symptoms, we conduct certain investigations. First of all, we'll check whether your joints are tender or not, they're swollen or not. Clinically, we examine. We take the history. Does anyone in the family suffer, or you are the first one to have this problem? Then we do certain investigations. There are certain investigations which gives us a clue, like what type of rheumatoid arthritis it is, or what type of inflammatory arthritis it is, and how severe it is. More number of joints getting affected, more severe is the disease. So we do investigations, like routine investigations we do, like complete blood picture, ESR, CRP. These are inflammatory markers, liver function test, kidney function test, and urine examination. So these are the routine general tests. And specific tests like rheumatoid factor, anti-CCP, uric acid, and if required, other tests like anti-nuclear antibodies and HLA-B27 to rule out other similar type of inflammatory arthritis. All these investigations are very much essential, because patients with rheumatoid arthritis can have sometimes anemia, that hemoglobin count may go down, so that also needs to be checked before starting investigations. Sometimes patients before reaching doctors might have took some painkillers, or they might have some abnormalities in the liver functions and as well as kidney functions. This needs to be identified before we start therapy. And rheumatoid factor test and specific tests like anti-CCP, these things are done to confirm rheumatoid arthritis. Once we do this blood test, along with this blood test, we also do imaging. Some people come with only pains. There will not be any swelling, but they suffer with severe pains. To confirm whether there is inflammation is there or not, certain newer tests like musculoskeletal ultrasounds help us to identify whether this is a truly an inflammatory arthritis or simple joint pain which will improve with physiotherapy and painkillers. And we do x-rays to identify whether there is any bone damage or not. MRI also may be required, but it's very rare. Nowadays with ultrasound and x-ray and blood tests, we can almost confirm rheumatoid arthritis, and we can identify the extent of damage happening in rheumatoid arthritis, and we can start treatment. So once we make out the rheumatoid arthritis diagnosis, and once we make out the severity of the disease, at what position the disease we are dealing with, then we think of starting therapy. Patients come to us at different stages. Someone who comes with an arthritis in a very early stages, like say someone who comes with the symptoms of less than 6 months, we call it as an early rheumatoid arthritis. Somebody coming at a late stage after 2 years of symptoms, we call it as an established rheumatoid arthritis or late rheumatoid arthritis. So it is very easy and convenient. So patients who come to us early, within 6 months, we call it as an early rheumatoid arthritis. Patients who come late, after 2 years, it's an established rheumatoid arthritis, or we call it as an late rheumatoid arthritis. So it becomes easier to treat early rheumatoid arthritis because the bone destruction won't happen. The extra joint symptoms or arthritis plus symptoms might not be there in an early stages. So if we start treatment in this stage, that is early rheumatoid arthritis, there are good chances that these patients can go into remission for a longer time and they can get cured. But those patients who have a later disease, like the disease is there for more than 2 years, when we have an established disease, the chances of going into remission or the chances of getting it cured might be very less. By then, there are chances that the bones might get damaged, the disease might have already spread to other organs. So the key in treatment of rheumatoid arthritis is the identification of the disease. So the early diagnosis and early treatment will help us in reducing the long-term damage, and at the same time, we can push the patients into a phase called drug-free remission. So where patients might go into a completely controlled stage where we might not require the medications also. So we aim at doing that, but the success can be achieved only if the disease is diagnosed at early stages. So once we make a disease diagnosis, we also assess any other organs in the body are also affected with rheumatoid arthritis or not. So what are the organs? So patients with rheumatoid arthritis can have dry eyes, dry mouth. So this is one of the complications of rheumatoid arthritis. More often, patients get confused when they are on treatment with rheumatoid arthritis. Suppose if the treatment were to be inadequate and the treatment is not sufficient to control the disease, they might develop this arthritis plus symptoms or extra articular manifestations where they might develop dryness of eyes, dryness of mouth. This is because the glands producing the secretions in the eyes and mouth can get affected. The tear production may stop, the saliva production may stop. This might lead into dryness and gritty sensation in the eyes, and if not identified and treated earlier, it might lead into red eye, painful eye, and there might be ulcers developing in the eye. So this is a very late complication. So this is called scleritis or scleromalacia. So this is an advanced complication of eye which can occur in rheumatoid arthritis patients if not treated early. Similarly, patients might develop severe dry eye, there might be dental caries, there might be tooth decay happening in these patients. It has also been observed patients with recurrent dental infections, those who have a periodontitis, can also have very severe form of rheumatoid arthritis, or it might lead to rheumatoid arthritis. So tooth hygiene or dental hygiene is very important to control rheumatoid arthritis. So, and other problem apart from eyes and mouth is lung complications, which is one of the dreaded complication of rheumatoid arthritis. So most of the patients with rheumatoid arthritis who are not treated properly over many years might develop lung fibrosis or stiffness in the lung. So this condition is called interstitial lung disease. This is a late complication of rheumatoid arthritis. Again, patients also do get confused, and sometimes doctors who do not have an adequate knowledge about the complications of rheumatoid arthritis may also get frightened, panic, and they may also press the panic buttons in the patient by telling that this could be a complication of the medication what they are taking. But actually, the lung disease which the patients with rheumatoid arthritis develops is a complication of rheumatoid arthritis itself rather than the medication what they take. Inadequately treated or poorly treated patients with rheumatoid arthritis might develop a late complication of interstitial lung disease. Other complications, if arthritis is not treated, might lead into kidney disease. There might be a condition called amyloidosis. A chronic inflammation leads into that condition which can commonly affect kidneys and as well as skin.